Okay, welcome back. We're switching topics to H218, the opioid abatement special fund bill. And we heard testimony from the commissioner about this. We were able to ask a bunch of questions. And I just want people to know that we did seek testimony, an opportunity for testimony from members of the committee itself, other than the commissioner. And the witness who was here last week surveyed folks, sent out a request to see if anybody wanted to be, to do this. They don't have there's not a sort of a leadership position. Hence, you'll see a recommendation for change in this bill that reflects that. So it didn't seem appropriate to have one person who was the same witness that we had last week to talk about the just the process that was used. It was an uncomfortable position to, I felt it was an uncomfortable position to put her in the position of speaking for the whole committee when she really hadn't been elected or authorized to do that. So we're going with the commissioner's testimony. The spreadsheet we have from Nolan, which is very handy, Nolan. And the additional language that I had asked Katie for an amendment to actually try to solve this issue about needing to have a co-chair from amongst the committee that's not an administration person. I'm just wondering, Nolan, if you're fine there, if you're comfortable there, but have you received anything from the health department about this middle section that says unspent obligations and the like? Because I know I in a side conversation, don't be honest with you, her name's Candace, and I can't remember which organization she's from, but she said, thank you. She said they actually had received their money. And on here, and on here it says it's not. I don't know what the department is report. I don't know what's actual from the department.
For the record, no language on this clause. Yeah, so this, the status as of February 1st. I know that we had asked the health department to provide us, and it was you, what they think would be unspent. I think with that, we can request that there's an update on the status of these as well, but I don't have any new updates.
Okay. Okay, we had asked the commissioner yesterday to provide that to you, and I think we have, yes. Hello.
And they're working on it.
Yeah. They're working on it. Okay. Okay. Because I think the status they provided as of 2/1 might not be totally accurate. From what people who were sitting around the room said, well, we've received our money, or, part of it. And on here, it looks like it wasn't. So
as far back as November, right, too.
Yeah.
So not just like in the last few weeks.
Yeah. So I think it's a thing inside VDH in terms of, and I think the commissioner seemed a little surprised that there was this column that had so much, that had been unspent yet. And yet, in past years, we've also heard of issues in timeliness in getting grant money out the door. So nothing surprised me, just want to have as much accurate information as possible. The other thing I want to point out to people, which I forwarded, was a copy of an email that I received from Teresa Vizina. I don't know if I'm pronouncing that last name right, but she's with the city of Burlington. And she believes that they will you could read it for yourself. She believes that they'll be executing an agreement and spending all of that money that's allocated this year. We'll have some discussion about that. Okay. Katie, would you just, I don't think we need you to go through like the individual sums and all that, but would you just review with us the language that I had asked you to make with regard to sort of leadership within the.
Sure. There have been a few other changes. Could I, Katie McGlynn, Office of Legislative Counsel. Is it okay if I just highlight each change?
Oh, absolutely.
Okay.
Yeah.
I don't want you to miss it.
And other changes requested by,
Things I've heard you say, like
Okay.
one is the commissioner mentioned that there weren't two new recovery residences every year, so I made that adjustment. I just want you to see those.
yeah, that's great. You're showing it up there.
So here's the recovery residences. So this language 3A has changed. The 1.2 million Department of Health recovery residences certified by VTAR. And this had said, two additional facilities this year. So that language is gone because that was last year's language.
By the way, I just want to mention, also in the side conversation yesterday, said they actually opened 4 new facilities.
Oh, great.
Yeah,
Awesome.
go ahead, Doug.
And is the understanding, do we need to be any more specific than that? Were these funds supposed to support specific recently opened recovery residences, or it can be spent at the discretion of the Department of Health across any certified recovery residence?
I'll be honest, I don't know how the monies get allocated out. I don't know, Eric, do you know exactly how that happens? Or
And we-
I don't know if it goes to the one organization that then, divvies it out, or if it goes to each individual organization.
I don't have that answer.
Okay. So the point is that we appropriate money to state entities by the most part. I'm going to say there are exceptions. So, but appropriations committees don't like to appropriate to non-state entities except under unusual circumstances. Yeah. Okay.
That's the first change. I'll walk you down to section 2. If you remember, when we were looking at the original language for the advisory committee and the settlement fund, there was a term that we had replaced. MAT had been replaced elsewhere in statute with MOUD. So I tried to clean that up. There was one section outside of the subchapter, but in the same chapter that also needed to be updated. So I went ahead and threw that in here too, hoping that would be okay. So that is what you see at the top of page 6, limitation on prior authorization requirements. You'll see on lines 3 and 4 and on lines 7 and 8. And the only change is swapping out MAT with medication for opioid use disorder. And we get into subchapter 2, which is opioid settlement. This is the language we looked at yesterday or 2 days ago. And again, conforming changes with regard to MAT to MOUD. So you'll see at the top of page 7, providing MOUD. This one is a little bit interesting on lines 4 and 5. Appointed by the Executive Director of Blueprint for Health to provide statewide perspective on the provision of medication for opioid use disorder services. I also struck this providing, so it's not a straight 1-for-1 replacement, but it read better to me to not say the provision of providing. Subsection C, straight swap out on lines 10 and 11. What page am I on? Still on page 8, subdivision 2, line 7 and 8. Again, a swap out of the terms. And then this is the language we were talking about with leadership in subsection F. So this says that annually the advisory committee shall elect a vice chair from among its members.
I think we need to say non-state government members or something like that. It's
So that there's also, it doesn't currently say that there's chair. It just says the Commissioner of Health calls the first meeting.
He's
Later.
it's
it says
like a cutout of this draft.
Oh, okay.
But when he's a
Non-voting.
he's when the
Right.
commissioner is appointed.
Okay.
It says non-voting chair.
Yeah, okay.
and I just we should probably make sure that because the commissioner is non-voting, do we need to specifically say that this vice chair is a voting member? It's a question, I guess.
I don't know. I guess I assume it's implied if we're not saying non-voting, but it
Okay,
never hurts to be extra clear, so we could add it.
Are there other non-voting members?
No, just the commissioner. Do you want
yeah,
to say?
the commissioners, we don't see that here because we're only seeing part of that section of law, so I think you're fine with that. I was just a question.
Okay, so you want to say from among non-governmental members?
Yeah. The only reason I say that is because there's another government position on there.
Right, you want the chair and vice chair to both
Right, to
be
both be
yeah,
government officials.
Okay.
Yeah, go ahead.
If we have from what you were saying earlier, do we have a desire that there's someone other than the commissioner who we would expect or hope would come speak to us? Do we want to be specific that the role of vice chair includes?
We don't need to say what the role includes, but it gives us the opportunity they will then have elected somebody to speak on their behalf. And so instead of now, we were kind of like scurrying around trying to find somebody to speak to us. We started with the legislative member from the House, and that person wasn't available. And then so we sent out an email to a person that we knew would respond, and she did, and she appeared before us last week, but it wasn't really fair to put her on the spot to speak for the whole committee with regard to the recommendations. I mean, we have the letter, this bill reflects the same thing that the letter reflects. So no, I don't think we need to be any more specific.
And then we just have renumbering on the top of page 9. And we get into the special fund language, and you'll just see the swap out. So lines 12 and 13 is a swap out, 14 and 15 are exchanging terms. Same thing on top of page 10, lines 1 and 2. Lines 10 and 11. At the bottom of page 10, line 18. And then on page 11, lines 3 and 4. And then you have the effective date of July 1, 2025.
Okay, thank you. Anybody have any questions in the substituting out of MOUD for MAT? Right, okay, all right, so we don't need to go through and approve each one of them. Okay, so and what about the vice chair?
I just wondered if,
Yeah.
on that, if maybe where it refers to the chair, maybe it could say the only non-voting chair, the only non-voting person at the mention of the chair.
The chair, it is specifically, it does say, we just don't see it here.
But it says he's non-voting, but I wonder
Yes.
if it said the only non-voting. So it would imply that everyone
Oh.
else is a voting.
Is a voting member.
I don't know. If that's right.
I think if you're concerned about that piece, we could just say a voting vice chair from among, selected from among non-governmental members. I don't think there's a problem adding that word in if that
Okay,
makes everyone feel more comfortable. Okay.
I don't really care. It just-
Voting vice chair. Okay. Good. I'll add it in.
okay, now let's get to the meat of the bill. And the money. Okay, so we're just saying in section 1 that it's being appropriated from those following places. Okay, so and I guess what I'm going to do is to encourage people to be thinking about the testimony that we had from the commissioner yesterday. And I had forwarded to you quite some time ago both the recommendations from the commissioner and the recommendations from the committee. They match. So and now we have to determine whether or not we agree with those recommendations. So and what we see on this spreadsheet. So the first is the 1.976 to fund 26 outreach or case management staff. And I feel a little bit at odds because we don't really have the unspent obligations, things that might be unspent by July 1. And in some cases, we might then either say something about carry forward, or we might reduce the FY26 appropriation by that same amount because it wouldn't have all been used. What's the committee's thoughts about that? Because honestly, we don't have the updated information and,
Can we do that generically for all of them? Just at the end, say, these, these monies, be subtracted by any unspent money carried over. That's not the right wording.
I get what you mean.
yeah,
Do funds automatically carry over or
No, they don't
we need to,
carry
we
over.
need to specify?
yeah, we would need to specify what we would want to have done with those. So, yeah, go ahead.
But they stay in the special
Well,
fund.
that's right, that's right.
So
Yeah.
it's not like they get swept into.
They don't get
the
swept
general
into the general fund.
So,
That's true.
so
They
either
do
way, they
stay,
stay in the
yeah.
bottom line, so it doesn't really
So-
matter.
Yeah, go ahead.
They're
Bill.
not getting
For
doubled.
record, no line items on this, but you could say something like unspent fund shall be carried forward for the purposes. So it's clear they don't just drop to the bottom line, but the spending authority continues for those.
For the purpose, for that purpose that are outlined in the bill. Go ahead, Brenda. I can't hear you. You're not sitting in your chair.
Hit the space bar.
She's on her iPad. Doesn't work on the iPad.
Uh,
You could come next door and sit with us.
Yeah, but I don't want to disturb you when I leave. Do you want me to run in and vote?
We are going to discuss each thing and then we're not voting on this bill today. We're
Okay.
voting on it
I
tomorrow.
didn't know. Okay,
Okay.
thanks.
So Nolan, has a suggestion and because it's true, it doesn't go to the bottom line in GF, but it does stay in the special fund. But if we want it to be utilized for the same purpose for which it was intended, that's a thought.
But if we're appropriating the full amount again, we wouldn't want to double up the unspent. We would want the unspent to be able to be a future legislature decide the priorities that year.
Or even this year, even some adjustments for this year, yeah.
Well, that's kind of what I'm thinking. I'm wondering if there's lead-in language that we can say that, going along your suggestion, and that, in fiscal year 2026, the following sum shall be appropriated from blah, 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 blah. But we might have a statement in there that says that they would be adjusted from any unspent, that these amounts would be adjusted with any unspent funds from the prior fiscal year.
Yeah, that was my intent, but when I realized it's all staying in the opioid special fund, I'm not sure that that makes any difference at all. We want them to have this much money for this year, whether it's carried over, because we say carry over and then don't add additional money this year, or whether it just stays unspent in the opioid fund to be reallocated in a future year, doesn't actually make any difference. Assuming we're not intending to give them more than 1.9 million next year for that purpose.
I am wondering, this is a wonder, that if we don't say something, and so I'll just use most of these things with the exception of the overdose prevention center. Most of these things have grant agreements already.
Mhm.
And the dollar amounts have either not been fully spent, which is common. We're only 8 months
Right.
through the fiscal year. So if it's I don't know what happens at the end of the fiscal year I don't know what those
Right,
individual
they
grant
may-
agreements say.
And they may still need to be reimbursed for, yeah.
Yeah, yeah, go ahead, Noel.
If I can, I might suggest for this one, it's obligated, which means that they are planning to spend it. So I wouldn't sweep anything that's already obligated. For this one, I might just reappropriate 1.976. And then next year, you see how much of it hasn't been spent. They might need all of it because they might need the current, we don't know how much that 1.5 is going to be spent in the next 4 months, right? If it's already been obligated. And then it might have, and then you have 1.976 is for the full year. So for this one, I might suggest you not touch it. You just appropriate the full 1.976. And then you revisit it next year. If it hasn't all been spent, then maybe you start readjusting. Because it is going to follow the bottom line of this fund.
And these first four are things that are ongoing in nature. We'll talk about the number two separately, but
It's the Unobligated stuff that I think you should have a conversation about, but the obligated I might leave alone for all of them, except for maybe OTC, right? Because
Right.
Yeah, I mean, the obligated
Well,
means that they have a
OPC is
grant
obligated.
agreement, they have a grant agreement that backs that up. Yeah. And without looking at every single grant agreement, I don't know what the provisions are for, how they're drawing down each one of those. Okay, so is there any discussion or any, potential amendments to this 1.976? That's a continuation from the current fiscal year, for 26 positions. Okay, I'm not seeing any, so we'll move on from that one. I'm
Just
just,
to clarify, I'm sorry, that this means that we agree with the
yes,
appropriating.
nobody's proposing an amendment. That means we're
Great,
agreeing.
Thank you, just clarifying.
Yes.
Thank you.
Yes. We're gonna bypass number 2 for a moment. Because we're gonna have to have more discussion about that. Okay, number 3, 1.2 for recovery residences. Again, this is a continuation of what was appropriated last year and what has been obligated for this year. Are there any questions, suggestions? Okay,
Question on the funded annually at not less than fiscal year 2025 levels. That repeats, is it 2025 or does that get updated to say 2026?
well, it's the same amount, so honestly, it doesn't really matter.
Okay.
The intent when that language was, or a variation on that language was put in was that we wouldn't reduce anything from that level. So it was intended to be 25, yeah. Okay, syringe services. Again, same amount, however, this is where there might be a change. They have, you recall the testimony from Dr. Levine saying they put out an RFP. They got one response for $50,000. So it seems pretty clear that 300 of that is not going to be obligated in FY 25. They are going to reissue an RFP, trying to, keep with legislative intent for expansion of the service. So what do folks want to do with this?
I wonder if we reduce this by a little bit because, at least by that 350 that hasn't been obligated, yeah.
It would be, I would leave at least 50 in there because they have a response for 50.
I know a little, I would like to leave a little more extra in there beyond that 50. You said they're gonna do just in case,
They're doing another RFP, so I mean, we don't know, we're not reducing what's here in FY 25. We don't know what the response to the second RFP is going to be. So if they don't have responses that equal the amount that we put in this bill, then they're not gonna spend it.
Yeah.
And it stays in the fund.
Stays in
Yeah,
front.
so
Yeah.
maybe we leave it.
So
Leave it.
there's no harm in leaving it where it is.
Yeah.
You have a thought about that?
I think we should reduce, but I'm in agreement with leaving a certain amount in there, but maybe reducing it by 200,000 and leaving 150,000 on in there. And then discussing maybe if that $200,000 can be allocated to another initiative that's being funded that may be a little bit underfunded and be utilized in that capacity.
Well, so let's hold a, do you have a proposal about that?
I would recommend this is just my recommendation. Is to reduce that by $200,000 and allocate it on over to the recovery residencies. Only because we've been hearing the testimony in regards to their expansions and some other initiatives that they need.
The one thing I will say is that we have learned that they actually expanded by 4 instead of 2. So,
That's where that was coming from.
right,
So there's more.
so there are more
support
need to
ongoing.
support that.
Inflation.
I'm good with
I
that.
like that.
Yeah.
Okay. So, I'm sorry, would you state that again? My brain is still on, trying to think about, other language. So, what we're saying is that we would,
Reduce the syringe, services program by $200,000 and allocate that $200,000
recovery residents.
down to an annually funded recovery.
So move that up from 1.2 to 1.4 million.
Yes.
Okay,
Change the syringe services to 850.
to 850, yes.
Ask what you'd like to do with the legislative intent language. In both of those sections, they're both at the 25 level. You can,
It says not less.
not less, you can keep it, but then the next one you have gone less than the 25 level.
Oh, well, yeah,
Fine.
obviously we change it. Maybe we go back to Doug's original question and maybe we want to update all the 25s to 26s.
Well, maybe, do you think that you would like to see this amount next year? Or would you like to see the 25 amount proposed?
Well, I mean, we have 4 new residences, and so I think that it would be short-sighted to say that we would just want to take it
that
back
for-
to 1.2,
Right.
do it for 1 year. So
26?
so I think we leave that one at, we put that one at 2026.
Okay, and what do you want to do in subdivision?
I can just, what I'm predicting is when this goes to appropriations, they're going to be all confused about why some are 25 and some are 26. And they're going to say that must have been a mistake and they're going to want to change it. So I'm just trying to
Change
avoid,
everything to
right, I'm just
26.
trying to avoid confusion.
So make them all 26.
Yeah.
Yeah, just keep doing what we're
And we're
doing.
saying not less than, so it doesn't mean that we couldn't
Okay.
increase it like we just did, right?
Except we did just also lower one, but was that,
We
Right.
ignored last year's intent.
That's
That's
why we
okay.
wanted to do
That's why it's only 10, it's not binding. Yeah.
It's intent language.
intent language?
Oh, come on.
The intent of the 2025 General Assembly.
Okay, all right, so now we are moving on to number 5, the 800,000 for contingency management. That
Yeah.
one is all obligated, but doesn't look like it's spent, but I suspect that probably has been spent, but.
Say, I would not be able to re-describe what that means, but I understood it when I heard it and I support it.
Process.
The incentive.
Those are the incentives to stay clean.
Okay,
It's not
yeah,
the-
it's great, right, they used a lot of it for training this year, but then it'll kick
That's right.
in. Yeah,
I asked if they said they used a significant amount for training
Yeah.
and I asked, well, then would you need to keep that in if you've already trained people? And, of course he said yes.
because now they'll be rolling out the
Rolling out
program
the
more
program.
fully and it'll.
Yeah. I think we'll learn more about that next year.
I
Exactly.
support keeping that in.
Yeah.
At the same level.
I do too, because it's gonna be interesting to see how much of that is gonna be like amount that wouldn't be unobligated.
Right.
Because $800,000 contingency management therapy is incentive driven.
Seems like a lot.
That's a lot of gift cards.
That's what I said. That's what
I mean, what are we giving out, cruises? I did, I don't mean to be cynical, but I'm gonna be interested to see how much of that money's gonna be unobligated
At the end of this year.
at the end, and
Yeah.
then that'll
And then
give us
next
a better base level on where to maybe going to.
Yeah, so we'll need to run this report for 2 years next year.
Yeah, it seems probably premature since it was a new initiative last year. And it required some extensive training that we should give it another year. But I agree. That's why I asked that question when he was here. I'm like, a lot of gift cards. Okay, number 6, to DOH for Brattleboro to establish community training programs. I have to say personally, I like some of these smaller amounts going to local communities
those,
and
yeah. Yeah.
Anybody have any issues or questions about that one? Okay. So this is gonna be the simplest bill that we do all session. Okay, 44,229 for Champlain Housing Trust to continue pilot program for wound and preventative health care for low barrier shelters. Healthcare related, I think this is a good continuation.
Mhm.
Okay, this one, I don't know, I think I feel like, I don't know how I feel about the next one. $800,000 dollars to DCF, for long-term programs at shelters. Really talking about harm reduction and clinical nursing, and, I guess we should give it a try.
What gives you pause?
I'm, there's this like part of me, it was kind of what I brought up yesterday of like, I just think it's my head wasn't thinking that we'd be making grants to state departments.
Right.
But
Does seem-
the reality is that really isn't going to the state. They're going to distribute it out to the community, which is actually a little bit different than the one coming up for VR.
It's to give to the long-term program
Right,
at shelter,
right.
right? Yeah.
So that's why I don't have as big an issue with this one. But I think we should have some language in here about the effectiveness or some report back on outcomes, or which we don't have. We're doling out money. We don't have any outcome language.
I like that if we're gonna,
Yeah.
Well, it's a progress report. Shouldn't that be a condition of one of the grant? He did say it was a condition of the grants. Do we have it?
We have language this year. This is all grant agreements associated with the funds appropriated pursuant to the section.
Oh, yeah. Okay. I know where it is.
Oh, good,
But
okay.
that doesn't come to the General Assembly. That comes to the department that issued.
It does, but at least we could ask for a report on that.
Right.
Yeah.
Right,
Could we get,
because I was wondering about.
Since,
no, I'm sorry.
since we're on that topic, I wonder if there's a way to ask for the advisory committee to show us how they're connecting the recommendations to the things that were outlined in the initial, like the uses for, because like they're getting proposals, right? And I wonder, are they evaluating those proposals just based on each proposal that's coming in, or are they going back to see, okay, are we actually fulfilling,
Criteria.
right?
These meet criteria, yeah.
So is that, well, sorry to interrupt. That could be like a presentation that you're asking them to come prepared next year when they present next year's recommendations, to come prepared to talk about how each recommendation fits within one of the criteria.
Yes.
Okay.
And it kind of makes me also, just like, we're talking about this like homelessness, like the statewide coordination is, are we looking at, what are the things we need to be addressing and then matching projects, or just kind of,
Also, it would help us
Yeah.
think about integration over time,
Mhm.
right? Like, we don't want to be funding these disparate groups all over the state that might be overlapping and doing similar things.
Yeah, it'd be nice. I mean, I thought of that back with 1A, 26 outreach, like, do we know how many people they actually connect with in those different places, or does somebody know? How many individuals they connect with, and where within the network did those positions end up? Distributed around the state, or just all in 2 counties, or?
Yeah, I mean, I think that
we're
part of
turning over a lot of it without knowing.
Well, yeah, I was just gonna say, a lot of it does come down to the utilization of the advisory committee and their evaluation of the proposals as submitted. And I think it warrants probably further thought about how much information that we should have. And I think it should be a bit more than, I guess I'm agreeing with what people are saying. It feels like, yeah, we're putting out a lot of money out to different entities and for different things, and it's probably good, but how do we know it's good? And how do they know it's good? And sort of those
I wouldn't mind putting.
results-based accountability.
Yeah, I wouldn't mind
kind of-
putting
Yeah.
faith in their recommendations if we knew that what you were, if we knew that they are
Thinking about.
looking at
right.
those things, looking at, before re-recommending the same thing, looking at.
And I do want to
Outcomes, yeah.
acknowledge that
It should have
Jess
that-
and
that
Dr.
language at
Levine,
the
when
end.
they presented, they did say that they're working, I mean, they're fairly new still, right? And they've been really working to improve their processes and how they evaluate and how they But I think a little direction from us wouldn't hurt to say, like, make sure you're telling us how you're tying it all back to the initial intent.
Well, I think that maybe we could add a C or something under the grant agreements thing and saying that summary of data measurements collected be provided to the advisory committee to help inform their recommendations or something like that.
Well, right, B could just say collected and reported to the department issuing grant and to the advisory committee. And then a C, that the advisory committee shall use that, the
Yeah.
data on
Something
outcome and
along those lines.
measurements as part of its
Deliberations.
deliberations for the next year.
So do you want that language to be ongoing in the green books, or do you want a 1-year presentation that includes that linkage of the criteria?
That should
I
be
think
ongoing.
ongoing.
Yeah.
Ongoing?
Yeah.
Okay.
Yeah, sorry, I'm the speaker's trying to decide where to send bills and I'm having to provide her some feedback, so.
I guess a question back to, Madam Chair, you're expressing some reservations about funds that just get allocated to the department within state government. And it makes me think about that question and also the prior number 7, the $44,000 ultimately going to CHT, which I like that idea, but says to continue a pilot program providing access for wound care. Was it funded through this way last year, or was that Department of Health funds that funded the pilot? And now they're moving it over to the opioid abatement special fund. And I ask because in the statute, it talks about how these funds shouldn't supplant, shall supplement and not supplant or replace any funding that's coming from federal or state sources. So with that one, with the wound care and CHT, if the Department of Health paid for the pilot,
Yeah, then.
technically it didn't seem like we should be funding these. I like the program, but are we relieving the Department of Health and the general fund of things when that's not the intent of the special fund?
Although technically, if it was a pilot program, then it's just that 1 year of the pilot, and then it doesn't exist anymore. So it becomes a new,
So we're not relieving them.
we're not relieving them. They didn't have an obligation to continue it if it was a pilot.
Would that be true for number 8, the 800,000 for DCF, Office of Economic Opportunity, to support the long-term programs and shelters for individuals?
Programs.
Well, but the programs are long-term, but the addition of these specific added supports.
Is new.
I think the long-term is referring to the shelters,
Shelters.
not to the these specific harm reduction services.
So we understand this to be a supplementing of programs, not a.
Yeah, something that has not existed, yeah.
Okay.
Yeah, go ahead.
He brings up an interesting point because we funded a agency's contingency management pilot. So would they be eligible to access the $800,000 available now through contingency management services?
Would who be?
Pathways Vermont, or is getting funded the $35,000 for the contingency management.
Well,
pilot.
we had that question yesterday, and I think I even asked that question, like, why wouldn't they have access to this 800,000?
Yeah, I'm reflecting back upon it,
Yeah.
but I don't think we really got it clear.
Yeah.
Well, he said, well, that would be, he said something about like, well, that's a good question or something.
Yeah.
Um,
Yeah,
So-
so that's why I'm re-engaged. in
When
it,
we
yeah.
get to that, let's just,
Go through the.
right, I feel
yeah.
like, I'm not sure, did we land, Katie, did you
Katie,
land
yeah.
on the thought about data being reported to the committee?
Where to put it.
Okay, all right, thank you.
Sorry, Katie.
No, that's okay. We start going haywire here for a minute.
Yeah,
We
yeah.
did fire department, we did Champlain Housing, we just did the 800,000. Okay, we're on 9, 309,000 for HCRS, that's healthcare and rehabilitation services. Do you think
Does it
we
need to
should
be said
spell it
that?
out?
Yeah, I think it does.
Well, I went to the
Swear.
website though, and that's how they referred to themselves. Is this HCRS?
Yeah.
It's healthcare and rehabilitative services of Southeastern
Okay,
Vermont.
I'm happy.
Yeah.
That, yes, I would love to put it in.
Okay,
up yesterday too. I was surprised.
And then-
People down there all know it as HCRS, but, and, you know, sort of state people do, but I think it's
What is it?
Healthcare and Rehabilitation Services of Southeastern Vermont.
Everybody who knows of them knows it as HCR.
Right.
It's a long title, that's why.
Southeastern Vermont?
Yes. Brenda, are you looking to say something? We can't hear you.
Can't hear you.
No? Okay. So that's Project Connection Works to reduce opioid use disorder, mortality and morbidity through prevention, treatment, and recovery services. Pretty general.
Pretty vague,
but,
yeah.
Sounds like a good use of. fun.
It's within the context of what's allowable,
Yeah.
and it's another part of the state, which is, I think, I'm glad to see some of the money
Yes.
moving outside Chittenden County. Yeah.
Then we go to, no.
Yeah. All right. And then we have 35,000 to DOC, to pathways. And this, I think, is a good question, which Eric just brought up. I'm not really sure, other than the money is going through DOC, which is a different avenue than through the Department of Health.
Yeah.
I'm not really sure why, other than the commissioner said that the 800,000 went to the preferred provider system. And
Although the language doesn't say, the language says to providers. If it said to preferred providers, then that is an established definition. It currently says providers, which would mean any provider could apply.
yeah, I think it seems weird to fund this one separately, to be
I
honest with
agree.
you. I don't know. What do other people think?
There's some benefit to have an organization, Pathways, that's connected and associated with the Department of Corrections to be piloting one to sort of forge a stronger connection between DOC.
Well, we can include language above.
Yeah, we can still include like
Well,
pathways.
this is for implementation.
Yeah.
I'm
The
just
other one's
wondering.
implemented. This, yeah.
Yeah,
I mean, Pathways has specific grants with corrections for housing, for housing first programs for inmates coming out of
yeah,
corrections.
yeah.
And so this is targeting that group of people, individuals under supervision. Whereas the to providers in that 800 is
For the ongoing, yeah, I think, I
sort of for another group.
Okay, it is for another group, but come on, people, it's $800,000.
Yeah, right. That's
Yeah,
plenty to come up with
35,000 of
35.
it can't be
Yeah, right.
applied
That's,
to
yeah.
this. That's
Yeah.
what my question is. Why can't 35,000 of that,
As Eric
Be
said,
applied
that's a
to
lot of gift
this-
cards.
Yes.
this use?
Oh, cruises.
That-
We're not saying to delete it, we're just
Yeah,
saying
we-
use the money out of the 800,000.
Yes.
Oh,
Agree.
Make them as a sub,
yeah,
Yeah, so can we add the language up in there, just making them as eligible recipients
okay. For the
for
800,000.
the 800,000, yeah. Okay, I am all for training judges.
so as
Yeah.
opposed to, yeah, right, because the other one is specifically for people experiencing homelessness, and these folks are not experiencing.
Right,
homelessness.
it's- yeah.
Right,
Well,
so it's almost like an A and a B.
we don't know that they're not homeless, I'll be honest with you. They could be under the supervision and still be homeless.
Yeah.
Yeah, go ahead, Eric.
so are we gonna allocate that 35,000 to another initiative or?
Not
just
yet.
Leave it into the, okay.
Don't worry, I'm at the ready with it.
Ann's got a proposal.
You got yours already, Eric. Let Ann have a shot.
No, it was just a question. I wasn't gonna go try to recoup it.
Yeah. All right, so 50,000 to the judicial branch to train Vermont judges.
Yes.
Everybody good with that? Okay, 76,000 to Vermont Criminal Justice Reform. That's their outreach worker.
Yeah.
Okay, so I do have a question
And-
about whether and maybe it doesn't matter to y'all. That's what 1.976, and I realize that's funding 26 different positions. I just didn't know if we wanted 1A1 and I
Why are
like
we
things that
calling
are the
this out?
same, it's
Yeah.
the same position to a
Right.
different entity for a different group, but
Why do they get?
Why are they
singled
having a
out and
designated
separated?
well, just
outreach
because they weren't
worker?
funded last year and it's a recommendation
Right.
this year, that's
Right.
all. I just like things that are of similar
Mhm.
categories to be grouped together, that's all. I was just talking about moving it up.
The other
This
two.
number 12 or 13?
Number 12.
Number
Number
12, to move it up underneath with this, with its own appropriation, but up nearer to 1A.
1.2.
1.9. Okay, so everybody thinks that dollar amount's okay with that group? Okay. Okay, and let's see, 200,000 to elevate youth services, counselors for the teen center at Kellogg Hubbard in Washington County. First time we've seen something in Washington County. Any thoughts about that? Seems good to me.
Yeah, I mean, I think it's a really good idea, a good example of an upstream intervene with kids this is like right at the right time when you want these kids connected. And that in terms of prevention activity,
Mhm.
which there isn't as much of
In here.
overall, I think it's really good.
Well, there isn't as much overall because we're spending a lot of money in prevention in another line item, which is why there's not as much in here. That's the only.
Which is a lot of prevention line.
We have like $11 million going to prevention in the Vermont Department of Health, 6.75 million of it coming from
Separately.
cannabis. Separate from
Right,
that.
right, separate from this.
Yeah,
Right.
separate from this.
Yeah.
So my only question is, it comes back to, and I'm not suggesting we change this year, but I think that we do need to have serious discussion about how those prevention monies are
Yeah.
going out and what we have coming back. Because
Similar discussion as we just had about accountability for this bill.
Yes.
I will point out just,
yeah,
it is my employer.
yeah,
The Healthy Youth Program is not just prevention, it is actually case management and treatment and or not treatment, but
Education component.
and for youth who already have a substance use disorder. So it's not just strictly prevention.
okay, that's helpful.
Yeah.
Yeah, okay. Anybody have any questions about
I have
that?
a question about Elevate.
Yeah, go ahead.
Isn't that the one that was only for foster kids, not all kids?
I don't know the answer to that question.
Elevate Youth has multiple programs. So one of their statewide programs is the Youth Development Program. And that is a program designed for youth exiting state's care. But they have many programs serving all sorts of youth and young
So the
adults.
short answer is that they have more than one program for youth exiting DCF custody and other programs for youth in general. And that's what this would be for.
When they came to talk, she told me no, that she sent 18-year-olds that were not exiting foster care somewhere else.
They were
I
talking
asked
about
her.
their program. They work for the youth development program at Elevate Youth. So their program, the youth development program, is only for youth exiting homeless
So
or
where does this
foster
money
care.
go? It's another whole organization?
This is going, this money would be going to a separate program.
Within the
Okay.
same organization.
Yeah, separate program. Not the
Okay,
same
well,
program.
So it would be labeled that.
Yes, separate
Okay,
program.
for all youth.
Yeah,
Okay, thanks.
okay. All right, so I think that this is probably a good place to stop because we have to move to the floor.
Okay.
And 1, 2, 3, 4. We still have a few. Yeah, we still have a few, but I don't think we're gonna make a lot of changes, Katie. So I think we can still kind of go through this and still get to vote tomorrow. So when we come back, we are going to hopefully take a look at language and then if there's been any updates on the dollar amounts that people have. Nolan tells me he's gotten people what they need as much as he's able to. So we'll do that and then we'll break